So you see what all is provided to you in the question is that the presence of a slurred speech, that means dysarthria, is indicative of the corticobulbar fiber involvement. Similarly, the clumsiness of the contralateral hand is indicative of the adjacent corticospinal fiber involvement. Now, these fibers, as you know, this corticobulbar fiber and the corticospinal fiber, they lie in the genu as well as in the adjacent part of the posterior limb. That means anterior part of the posterior limb and in the genu. These are the fibers which are present. And both of them are supplied by the lenticulostriate artery. So this constellation, it defines that dysarthria clumsy hand syndrome. So what is the correct answer? The correct answer is again B, that it is a corticobulbar fiber involvement because of lenticulostriate artery involvement. Now, why the other options are wrong, like corticospinal fibers, which are supplied by the anterior choroidal artery. Now, it would have produced, corticospinal fiber involvement would have produced severe hemiplegia, right? Which is obviously not present in the question. Now, option number C, the thalamocortical fibers would cause a pure sensory loss, which obviously is not provided to you in the question. And finally, the D, that means involvement of the optic radiation and the anterior choroidal artery, would have caused the homonymous, as we have already talked about that triad, homonymous hemianopia. So this is how you have to solve the questions accordingly and reach the final answer. And it becomes much easier once you have understood the basic anatomy related to this particular topic, that is internal capsule.